Yes, thank you, Madam President. And I rise in support of this bill. This is a bill that is a culmination of work out of the Governor's Office and the Public Health Committee combined into one bill. And as many of you know, we have passed some significant and very powerful opiate legislation in the past. I think that you will end up seeing each year a new attempt to create legislation to help us curtail the opiate epidemic that we're experiencing in Connecticut and across the country. Some of our cities and towns are experiencing a very acute, I'll say, symptoms of opiate disorder problems. And as you know, just yesterday in Hartford, we had a situation where we had 15 people overdose and 5 fatalities, but that was fentanyl. And that is something that the Public Health Committee will be looking at going forward. It was interesting when the Public Health Committee got together a subcommittee on opiates. We had law enforcement, we had mental health workers, we had clinicians. And one of the things that came to our attention was not only how dangerous the opiate epidemic is, but it is dangerous for those who care for those who have this addiction. And just a police officer obtaining or touching someone who has had a mixture of perhaps opiates laced with fentanyl can get sick from the fentanyl from just touching some of the remnants of the drugs that may be left behind. So I think that each year you will be seeing a new version. This bill is comprehensive. It touches on many different areas. One of the most, I think, really out-of-the-box areas that I wanted to highlight was an idea that we are going to be studying what it's like to have a home care-based opiate disorder treatment plan, and that's based on a visiting nurse model where you would have a behavioral health nurse who is trained in mental health and addiction actually go into the addict's home to check on them to make sure that their nutrition is proper and that their home is in order, that they are complying with the life skills that they would need to be able to not only help with their addiction, but to move on to bigger and better things. And it has had success in other states. This is something that I think the Public Health Committee would love to explore. Of course, we'd have to figure out how we're going to pay for it. But if we could measure the outcomes in a quantitative effort that showed positive outcomes, I think we would really be ahead of the curve in that respect, because we do know that treatment is difficult, it's long, it's expensive, and it's not always successful. So I would like to highlight that in this bill. And also I would like to thank everyone who contributed to this. There was a lot of great input from folks on the Public Health Committee, also outside of the Public Health Committee, obviously the Hospital Association, the Medical Society, those trained in mental health. We had EMS providers, we had police chiefs, and everybody is all on board, to do whatever we can here in the state of Connecticut to try to curb this epidemic. And I'm hoping at some point we won't have to have an opiate bill, and we will be able to focus on other areas. But until that time, I ask the circle to join us in supporting this bill. Thank you.
Thank you, Senator Summers. Will you remark further?